All right, it is time for our weekly Health Watch report with Dr. Syed Hussain from Trinity Health of New England. Good morning and welcome back.
Thank you.
Good to see you.
Likewise.
So we've got a lot to get to. First up, we're going to start with a new study that finds Americans are still following some outdated recommendations. A survey out of the University of Pennsylvania found that 48% of people incorrectly think that taking a low-dose aspirin daily can reduce the risk of a heart attack or stroke. We've heard that for a long time, but Doc, there's some research that led up to a reversal of that recommendation,
That is
right?
correct. Yes, absolutely, Sympathy. So in 2019, just to jog viewers' memories, the American College of Cardiology, along with the American Heart Association, a lot of different organizations came out with new recommendations based on data that suggests unless you've had a heart attack or a stroke, or you're a high risk because of certain underlying medical conditions, you should not be taking a baby aspirin daily because the risks outweigh the benefits. And when I mean risks, one of the biggest risks is either having a stroke because of a bleed or gastrointestinal bleeding. So this study found older adults still tend to take that baby aspirin even though it may not be warranted. Younger adults tend to be more in tune with, okay, what's out there, what other recommendations. I go back to the same premise like I've mentioned here on the show many times before is make sure you have a discussion with your primary care doctor before taking any medications, even if it's over the counter, such as baby aspirin.
Gotcha. And that's something I think folks don't think about. They're like, oh, I can just grab it at the drugstore.
Right.
It can't be that bad.
That's right.
Right. All right, now sticking with pain relievers, there is a new one on the market. Can you tell us about it and how it differs from others?
Yeah, this is the first since 1998 when Celebrex got approved by the FDA. So this is big news. It's the first pain medication, like you mentioned, in 2 decades. So suzetrigine is the actual name of the drug, and it has benefits of course, reducing pain without the side effects of opioids, because we know there's, we're in the midst of this opioid epidemic across the country. We're trying to wean away from opioids when and if possible. So this offers an alternative approach, especially for those patients who've had surgeries. The studies looked at abdominal and foot surgery, for instance. And it's interesting how the researchers actually came about this mechanism of pain reduction. They looked at a family in Pakistan who were firewalkers, and they couldn't really sense any pain, even though they could sense temperature and touch, but there was no pain. So that led to this, ultimately, a couple decades later, this research where we've now come up with a new medication that blocks signals from a tissue injury, from a body part that's injured, from those signals going up to the brain where the brain perceives pain.
Ah, interesting.
Yes.
And this would be a safer option for some folks. It could be, rather.
Absolutely.
Okay.
Now, a lot depends on how insurance companies would cover this and all that. We go through that regular drill whenever there's a new medication out, but suffice to say, it's promising.
Okay, that sounds good. And we've got one more big topic to talk about, prostate cancer. I think there's been a lot of attention on that in recent years, especially I believe it was Chadwick Boseman, the actor who played Black Panther, and that was something that he passed away from that kind of, got people talking about it again because he didn't speak about it before his death. But there is a new treatment available for that, right?
There is, and this is actually a screening tool.
Okay.
It's a urine test. And so this looks at aggressive forms of prostate cancer. Now, not all prostate cancer is aggressive.
Gotcha.
Sometimes the treatment side effects would outweigh the benefits. Especially if it's a slow-growing prostate cancer, you'd rather, as uncomfortable as it may sound, you may want to just live with it, per se. But the aggressive forms of prostate cancer, there are 18 genes that are associated with those, and that's what the urine test looks like. And now this urine test will be available to be done at home by men.
Wow. Okay,
right.
Good to know, because I'm going to keep it real. Sometimes men are too stubborn to go to the doctor, to go make the appointment, so they can do it at home.
Here's the caveat, though. Make sure you have a conversation with your physician before you think about doing this test.
Gotcha.
If you're a higher risk, then the screening guidelines are a little bit different. You may start earlier, such as age 40 and above, as opposed to 55 and above for anybody who's at average risk for developing prostate cancer.
Alrighty, good to know. Thank you so much for joining us again, Doc.
Thank you for having me.